Dr. Haywood, for those of you who don't know me, and today I'm going to show you how to start an IV and everything that we need to do with starting an IV using fluids and those type of things. So first of all, you check your orders and make sure that you do have an order to start an IV. If you have an order that says you're supposed to run IV fluids at a certain rate, it is automatically assumed that you are going to start an IV on a person, so you don't have to necessarily have an order that says start an IV. So what I do is I gather all my supplies before I go into the patient's room, and a few things that you're going to need to check. Let's just assume that this bag of fluid is what is ordered. These are usually in a bin or Pyxis machine that you will get them out of, but it is your responsibility to make sure that the correct fluids are in you're getting out the correct fluids. You also need to check, there's an expiration date on the fluids. You need to check the expiration date on the fluid, and you also need to look at the fluid and make sure that there's not any sedimentation or anything in the fluid. So this typically, a liter bag would be what you would hang for your primary fluids. Then if you had an antibiotic or some other type of medication, you would do it in your secondary, which is 50 or 100 milliliter bag. So you, again, check this. This is what you're going to add medication to hang on the pole. You will need an IV start kit, an extension set, a 10 milliliter syringe, and IV catheters. And I would strongly suggest you take several different sizes of IV catheters down in your patient's room, because depending on what's going on with your patient. If they are going to need blood, you're going to need to put at least a 20 gauge, if not an 18 gauge in them. And these, as you can see, they're color coded. This is a 22. Pink is a 20, and 18 is green. So that's pretty universal. So if they're going to get blood, you're going to put at least a 20 gauge in them, preferably an 18 if you can get one in them. So I take everything in my patient's room, explain what I'm going to do, and then I also ask them if they had a preference, whether they're right or left-handed, or have they had surgery to where there's an arm that I cannot use. You never stick a patient on the mastectomy side or the side if they have dialysis and have a vas cath in their arm. You do not stick that arm, so you have to go the other arm. When you're looking at the different landmarks, what you need to do is start just above the wrist. Starting it in the hand can be very cumbersome for the patient. Every time they move in the bed, they're going to be moving their wrist. Your pump's going to be occlusion. So it's better to start right above the wrist area. You start away from your patient and work your way up related to starting an IV. I know sometimes you're going to get a patient from the emergency room and they go straight for the antecubital, but that's not the best place to start with, because if you blow a vein up here, then you cannot go down lower at that IV site. So I gather all my supplies. I open up my start kit. The start kit is going to have some tape, your tourniquet. It's going to have chlorhexidine prep or some type of prep. It's going to have a small tegaderm, and it's going to have a 2x2 in it. So I get my tape ready. I go ahead and tear pieces of tape so that once I get my IV going, I have got everything ready. And all I need to do is hook everything up. Open up my 10 milliliter syringe of saline. Get my extension set. This is what you're going to connect right next to your IV catheter. Do not touch this. Push in and twist. Everything is luer lock. You can reuse this cap, but you need not to touch it and set it right side up. And so then I go ahead and prime this tubing to make sure, because you don't want to inject air into the patient. So once I've determined with my patient where to start the IV, which arm, then I put my tourniquet on. What I do is I take my non-dominant hand and reach across the patient's arm and pull, and this arm would be the left arm. I pull toward my patient's body, then pull up with the other one, go over, and then grab underneath. And the reason why I do that is because these flaps or the extra parts of your tourniquet are not in your way when you're sticking a patient. So I feel where I'm going to stick and everything's good, but if I'm ready, I can go ahead and put my gloves on. Some people will tell you to even feel you need to put gloves on. I'm old school. I learned how to start IVs before you had to wear gloves, so I can't feel veins very well. And that's one thing that you will do here when you come in the lab, is you will put a tourniquet on each other, and I want you to feel what a real vein feels like, because the veins on these do not feel like what a real vein feels like. They should be spongy feeling. So you hold up the arm. Like I said, with this mannequin, it's real difficult, but you would start down lower. But you would clean the area and you would let that dry. You do not touch back over the area. For purposes when you're in the lab, I'm going to wipe, just blot the area, because it makes it real slick for the IV catheters on the skin. But you would not do that in the hospital. Okay. The IV catheters have a little bevel on them. So you want bevel up, and as you can see, there's little indentions right here. That's where I hold on to my IV catheter. So I usually take my left hand and kind of pull the skin tautly as I'm getting ready to go in. You want to go at parallel to the vein. If you go too deep this way, you're going to puncture through the vein and you're going to blow the vein. So you go right next to the vein, get down next to it, and you'll feel a little push through there. You see how I've gotten blood return. I pop my tourniquet, then I hold on, and there's a little lip right here on my IV catheter. So I push my IV catheter, and you push that in, and there's a click. Then on a patient, it doesn't do it real well on the mannequins, I'll just let you know, but I put fingers here, right up above, about where the end of my IV catheter is. Twist this off, then connect my extension set, hold on to it just to make sure that it's moving. I check to make sure that I'm in the right spot. Then I put a piece of tape on it back here. Now I can flush it. It flushes fine. Go ahead, if you're done, and clamp off your little clamp. And the reason why you need to do that, because it will backflow blood. Then you lay your tegaderm, and you want to cover up both your IV site and your extension set connection. That will just help it stay on. And then this other piece you just peel off from around the edges. Now, if you can see this part right here, it says initials, date, and gauge. You fill in this information, and most people can tell what gauge it is simply because of the color. So you need to put your initials and your date on here, and then everybody knows when that dressing has been changed. Okay, so, and then what I do is take this up. Now, sometimes if you're just putting in a saline lock on a patient, I just make sure this is taped securely, and I usually put a piece of tape right here just so that this doesn't catch in the sheets of the bed and potentially get pulled out because it gets loose. If you have an order for doing an IV push and you don't have any IV fluids connected, what you're going to do is take you a 10 cc syringe of saline as your flush. Then you get you a syringe, whatever size syringe you need, depending on how much volume of medication that you are going to draw up. Clean the top off with alcohol. And just like you were taught last semester, you pull up the amount of air you're going to put in the vial. You draw the medication up. Withdraw it, and then secure your needle. Everything related to IV is lock, so you never stick a needle in. So what you do is you always, anytime you're going to do anything with your IV, you're going to clean off the hub, whether it's a Y site or it's right here. So I would flush, push in and twist, unclamp, flush, flush. As a general rule, I only give 1 milliliter a minute, so you would actually stand here and time it. And the flush before can be done fairly rapidly as long as you don't have medications in your IV line. But you want to flush and you want to give the medication slowly as you're going to be administering the medication. Now, if you don't have any IV fluids going, you flush afterwards at the same rate as you injected the medicine, because most of the medicine's probably here in this tubing depending on the amount of volume that you gave. So you would flush this area slowly and then clamp it back off when you're done. So that's what you do for an IV push medication. Peripheral IVs are changed out every 72 hours. So that's why it's really important for you to date and time your IVs, so that everybody knows when the last time the IV was started and when it potentially needs changing again. IV fluids. So I have checked, and my order is for normal saline. Everything's okay. The expiration date is within date.